Substance use disorders is an increasing phenomenon in the United States that's been made worse in the COVID-19 crisis. On this slide, you'll see that substance use disorder is pretty prevalent in the United States. We're looking at whether an individual has had a substance use disorder in the past year. And we can see that the majority of people have not, but a good chunk of the pie, 20.2 million adults, 8.4% have. And the majority of those are alcohol use disorder. But next is illicit drug use, followed by marijuana use, prescription cocaine, and heroin. There is some comorbidity between drugs of use. So we might have a person who's addicted to alcohol and addicted to other types of drugs, which is what we're talking about right now. So addiction to more than one substance. And we can see that the yellow region is representing adults who have only an alcohol disorder. The red region, the much smaller circle you can see, is representing the adults that have only a drug disorder. And this shared region are those who have both. The trends in substance disorders have remained fairly steady. Over here we have the percent of individuals, and these percents have been fairly stable over the last time. So we have alcohol or illicit drug use disorder, about the same percent of people, either or. Illicit drug use only, about the same percent of people. Alcohol use disorder, about the same. And finally, alcohol and illicit drug use disorder at the lowest level. The types of substances being abused include, at the top, marijuana, and these are illegal substances. Alcohol, of course, would be higher than the list, and marijuana is no longer as illegal as it was at this time. Cocaine has dropped off. Prescription pain relievers has increased, and heroin has remained low, but we do see that shift, that increase that we will observe a little bit more detail on a later slide. Comorbidity is the co-occurrence of a substance use disorder with another disorder, and we can see that having both depression and substance disorders can lead to a higher suicide risk than someone who has either condition alone. So we often don't know which came first. Some people have thought that, say, having depression, people what they call self-medicate or start to use substances to help themselves feel better. But it could be the reverse. We could have people who have substance use disorders, and the consequence of that fluctuating of their systems could lead to depression or another mental illness. And so just looking at these numbers are saying of those with substance use disorders, about 38% also had mental illnesses. And secondly, among those with mental illnesses, 18% also have substance use disorders. So that's what we're observing on this slide. So if someone has both, what kind of treatments are they getting? Not everyone with both of those conditions gets the right treatment. So the yellow region represents those who didn't get any treatment at all. Not everyone who has these struggles gets treatment and has the opportunity for treatment. In the red region, we have about 1/3 of people who received mental health care only, so the treatment for the depression but not for the substance. We have 4% in this green region who received only substance abuse treatment. And this little purple is probably what most people should be getting, which is treatment for both the mental disorder and the substance use disorder. The barriers to getting treatment, when it comes to these are specifically to people who have comorbid disorders and those who did not receive mental health care. Why did they not receive mental health care? More than half report that they just couldn't afford it. And then there are other barriers like not knowing where to go, or the belief that they could handle the problem without treatment, fear of being committed, fear of the opinion of neighbors. They didn't believe it could help. They didn't have time. Maybe they're having children and it's hard to get away. And they were concerned about confidentiality. And so here in a couple of these cases, we can see that stigma kind of thing emerging that Sam talked about earlier in the semester, that people fear even getting treatment because of that stigma. And among those with co-occurring disorder who didn't receive substance use, their reasons were a little bit different. Some of them weren't ready to stop using, 38.4%. And then we come to the cost factor. About 1/3 had no health insurance and couldn't afford it. And then we get to stigma again. It might cause neighbors to have negative opinion or might have a negative effect on job. And so those two factors seem to be related to stigma. And not knowing where to go and having insurance that doesn't cover cost, and maybe they didn't find the right kind of treatment program are some of the other barriers. Terms that we use include substance abuse and substance dependence. Substance abuse is defined as excessive use that results in hazardous behavior like operating while intoxicated, or continued use despite negative impact on social, occupational, educational, or health aspects of life. So if it's impacting your job, if it's impacting your school, if it's getting in the way of your functional family, these are indicators of substance abuse. Substance dependence is more severe because it includes a psychological need for increasing amounts of the substance. So the substance is no longer doing to you what it did before that caused you to become addicted, so you need increasing amounts. And so we talk about tolerance and withdrawal in conjunction with this. Tolerance is the need for increasing amounts of a substance to achieve the desired effects. And it means that your body has become used to you ingesting this substance, and so it's changed its response to it, and so it eliminates it, it metabolizes it differently and eliminates it from your body more rapidly. So you need more. And then withdrawal means that you don't feel normal if you don't have the drug. Physical symptoms that accompany abstinence from a substance. So you don't feel good. You may be, often anxiety is a part of a withdrawal symptom. So the DSM establishes 9 types of substance-related disorders. So alcohol, caffeine, cannabis, hallucinogens, inhalants, which are referring to very often middle school age children would start with inhalants, and these would be like paint cans or inhalant of fumes for the purpose of getting high. Opioids, sedatives, hypnotics or anxiolytics designed to relax, stimulants like cocaine and methamphetamine, and tobacco. The DSM-5 criteria is similar across substances. So the behaviors that are looked for fall into 4 categories. The first is impaired control. The individual cannot control use, has too much, uses longer, can't reduce, spends time on use, and has intense cravings. So the individual seems to have limited control over how much they're using the drugs or how much time they're putting into getting the drug and that sort of thing. Social impairment is continuing to use that substance despite problems in work, school, or family, and you're giving up other things that you used to do in order to, say, get the drug or use the drug. Risky use, you're using it when you shouldn't use it. Physically dangerous situations, so having alcohol, while you're about to do a certain job, or using your opiate when you're driving or at work. And you're continuing even though it's resulting in physical problems or psychological problems. And finally, the pharmacological indicators are tolerance and withdrawal that we talked about on the previous slide.